Good morning, Facebook. I am Megan Rogers with Indiana SHIP, the State Health Insurance Program, and I am coming to you from Northern Indiana, and I am joined by my lovely co-host Susan Spilly from Central Indiana in Indianapolis. Good morning, Susan.
Good morning, Megan. Good morning, everyone. Thank you for joining us.
Yes, so this is our September What to Know Wednesday. And next month is the start of fall open enrollment. It's a busy season where you can make changes to your Medicare plans, specifically your Advantage plans or your Part D plans. But you might also be deciding if you can or want to switch between a Medigap supplement or an Advantage plan. So gearing up for that time, we have a very important presentation. Susan is going to educate us this morning on a Medicare supplement and a Medicare Advantage plan. So we know the pros and cons and how they each work because they do work differently. And I have to admit, at first, I thought they were the same thing. And then I unconfused myself. So just know if you come to me, I know the difference now. So Susan is going to walk us through all of the important information on those two options, and I will be monitoring the chat, so feel free to chat in your questions while Susan is presenting. And we do keep this recording on Facebook for about a month, and then it is on our YouTube page as well. We do monitor questions that come after the live. So if you watch the recording and you have questions, you can chat in the chat box and we will respond to that. So Susan, I am going to turn it over to you to educate us on supplements and Advantage plans.
All right, I'm going to share my screen real quickly here.
Okay.
Okay, and just as a reminder, you can ask any questions you want by way of the chat, so feel free to do that. So when I work with clients, especially new to Medicare clients, I think, and then annually when there's an opportunity to change, the big thing that they are deciding is between buying a Medigap policy or enrolling themselves into an Advantage plan. So the purpose of today's presentation is to help you understand the differences. But let's take a quick look at Medicare because we'll need to see how those either supplement Medicare or encompass all of your Medicare. So as we know, Medicare is national health insurance, and there's four parts to it, A, B, C, and D. Part A is the hospital or skilled care coverage part. That has a deductible that can occur multiple times during the year. That's around $1,600, and it has co-pays as you stay in the hospital or receive services under the skilled care benefit. Part B is the medical or outpatient coverage. There's an annual deductible for that, which this year is $257. And then when you use your Part B services, you have coinsurance of 20%. So most people think that all of Medicare is that 80%, 20% split. But indeed, that really is applicable only to Part B. So the government or Medicare pays 80% of your Part B covered services and you pay 20%. But if you think about all of the things that come under Part B, which is all outpatient coverage, you can get surgeries these days as an outpatient, very involved procedures and expensive procedures like MRIs and PET scans, things like that. Well, 20% of a whole lot of money is a whole lot of money. And so it is could potentially be a big bill for Medicare beneficiaries if they don't have something that can cover or help cover that 20%. Then we have Part C, and those are the managed care, also known as Advantage plans, and we'll talk about those, of course. And then our newest part of Medicare is the prescription drug benefit, and that's Part D. First, let's look at Medigaps. They're also called Medicare supplement plans. And this title on this slide says supplemental plans. That's not really correct terminology. They're supplement plans, but they are supplemental to Medicare. They supplement Medicare. They fill in the gaps. And that's why I think they have these two names for them. But Medigap and Medicare supplements are the exact same thing, just two different names. And this is private insurance that you purchase from a health insurance company. There's all kinds that are available here in Indiana. And every state has its own Department of Insurance, and they have to make sure that these supplement plans are legit plans. So they have to meet Medicare criteria and they have to meet our Indiana State Department of Insurance criteria. And they're approved by both of those entities. Now, with supplements, like I said before, it fills in the gaps or supplements original Medicare. And when I say original Medicare, I'm talking A, skilled care, hospital care, and B, outpatient or medical coverage. It does help pay some or almost all of those healthcare costs that we talked about under A and B. Now, when you have a supplement plan, Medicare pays its share, and the supplement or the Medigap policy picks up the rest to the extent of the coverage of that particular policy. And we're going to look at different Medigap plans because there are several from which to choose. Now, in order to have a supplement or a Medigap policy, you have to have both Parts A and B of Medicare. And this is an insurance that you purchase from a company, so you're paying that company your monthly premium to have that insurance, just like you might pay your car insurance or your homeowner's insurance. Now, this does not get you out of paying that Part B monthly premium. This year, the standard monthly premium is $185 a month. And so you have to continue to pay that as well to stay on Medicare Part B. And as we know, Medicare is an individual kind of insurance. So are these supplement plans. There are no family plans for supplements nor for Advantage plans. Medicare is just about the one person. Here is a chart that shows you all the different kinds of supplement policies that you have access to here in Indiana. You'll notice they're called by the name Plan A through N, minus a few letters that have dropped off the wayside over the years. So let's just take a look real quick at Plan G. Currently, for new Medicare beneficiaries or for anybody eligible for Medicare after December 31st of 2020, then Plan G would be your most comprehensive coverage plan available. So you see all of these green checks. So it covers that Part A coinsurance, co-payments. There's a charge for every day you're in the hospital and several other charges, plus that deductible that can occur multiple times during the year. It pays all of the related hospital or skilled care benefits. It also covers that 20% of the Part B that you would have to pay for. It does have some coverage for blood. It is where you can get some coverage for your Part A hospice if there's any coinsurance or co-payments for hospice care. And it covers the Part A and B deductibles. Well, no, it doesn't. It covers the Part A deductible, but it does not cover the Part B. That's the only red X along this Plan G line. So remember, that's $257. And actually, for newer Medicare beneficiaries, there are no plans that cover that Part B annual deductible. But at $257, that's a pretty low deductible once a year. And it covers something called Part B excess charges. Now, excess charges are kind of a tricky little thing in the Medicare world. Providers of service can charge you extra or in excess of what Medicare assigns to a certain product or service. So if a provider needs to have more money for a service or a product, they will take the Medicare, what Medicare assigns to that item, and then they will have an excess charge, and they can charge you, the patient, up to 15% over what Medicare pays for that product or service. So this is called an excess charge. And some other terminology around this whole idea is accepting assignment. If you have a provider that's good to go with what Medicare assigns to a product or service, that means they accept Medicare assignment. They're accepting what Medicare pays for that product or service. And so there's no excess charge. But some providers do charge more, and that's the excess charge. So the moral of that story is when you're going to a provider, you want to make sure whether they accept Medicare assignment or there might be an excess charge that you'll have to pay. But if you have a Plan G supplement, it would cover those excess charges. Now, there's a couple of Plan G also has a high deductible plan, and this is kind of an old chart, but the high deductible amount that you would have to meet as your deductible is $2,870 this year. So as you can see, since 2020, it's gone up a little bit more than $500 that you would have to pay. And then once you pay that deductible, all of those Plan G green check marks kick in and you have excellent coverage. And that's the high deductible plan. Let's look at some other popular plans. Plan N, as in Nancy, is a popular plan. That doesn't cover, well, I think this chart is wrong because it does cover the coinsurance.
Susan, can I butt in?
Yes, you
Okay.
absolutely may.
Okay. So with Plan N, it covers some of the Part B coinsurance, but not all of it. So that is why this chart says a red X, even though it should be like a partial. It's
Right.
half and half.
And if
So
you,
it's $50 for emergency room visits, and then doctor office visits is $20. But then anything else for Part B would be covered at 100%.
right, and that's down here with the double asterisks. So it does pay 100% of the coinsurance, except that per office visit up to $20 or an emergency room up to $50. That is a rather shocking X there. I don't like this chart. I'm changing it for the next time. Um, uh, so that's the difference. It also doesn't cover the Part B deductible, and it doesn't cover that excess charge. Another plan that we're seeing with some popularity is Plan D, and that covers all the goodies except for the Part B annual deductible and that excess charge. So there would be no co-payments when you go visit the doctor or have to go to the emergency room. Also under plans K and L, the out-of-pocket limits, if you were to have one of these, K is now up to $7,220. L is up to $3,610. So you can see how much those have gone up in the last 5 years. So remember that these are also things called, they're standardized plans. And the standardized plans mean whether you buy your Plan D from XYZ Insurance Company, or whether you buy this Plan D from ABC Insurance Company, it's the exact same plan, reflecting all of these exact same benefits that you see here. Now, there are some supplement plans that might put a couple riders on them, add some extra services. But if you're looking at just straight up Medicare supplement plans, they are all standardized. But what could be the difference? Well, certainly the big difference is cost. Costs per month for the monthly premiums can vary greatly. I mean, you might find a Plan G supplement for a 65-year-old that's $100 a month, and another from one company. And then you might find a Plan G supplement that's $200, exact same insurance, different company. So it's important to look around and to make sure you know about all of your options. And ship counselors help people look at supplement plans every single day. And we have a very handy tool on our website that allows us to compare plans based on 4 different criteria. And that is your age. I mean, obviously, an 85-year-old Medicare beneficiary is going to pay more for their monthly premium than a 65-year-old is. Where you live, all insurance considers your zip code. It's those actuaries that look at risk and usage. And then so that your zip code where you live is very impactful on your monthly premium. And we just talked about the companies. Companies price things wildly differently. Now, if you're a woman, we're charged a little bit less than the guys. If you're a tobacco user, you are charged more. And sometimes with some policies, if you live in the same household and you buy the same policy, you can experience a percentage discount for your monthly premiums. Now, sometimes, unless you have a time where they cannot look at your medical conditions, which is called a guaranteed issue period, they will look at your medical conditions and they might charge you extra based on those. They can also deny you a sale of a plan or put other conditions on it, like waiting to use the insurance for certain conditions. So just really quickly for an overview, when you are new to Medicare, age 65 and older, and your Part B begins. So this could be somebody who's 67, loses their large employer group plan and signs up for Medicare to start because they're retired now. That will trigger a 6-month enrollment window where you have a guaranteed sale of the policy that you want. You can't be denied. They can't charge you extra for medical conditions. They're just going to look at your age, gender, zip code, and tobacco use. And of course, the kind of plan that you're interested in. Now, for new Medicare beneficiaries under age 65, a guaranteed issue period occurs as well. And this is something very new. Just this year, this started. So supplement plans A, B, and D are sold at the rate that they would sell them to a person who is 65 years old. All the other plans are sold without regard to your medical condition, but the companies can charge you up to 200% of a 65-year-old premium rate. But this is great news for our young folks on Medicare because many of those folks have a lot of medical conditions where they visit the doctor a lot, maybe receive lots of medical services. And so even spending 200% more than a 65-year-old Medicare beneficiary is going to come out cheaper in the end. And there are some other inherent benefits to a Medigap. So there's other times when you are guaranteed a sale of a Medigap policy. And that's if you're on an Advantage plan and the Advantage plan closes up shop, leaves your area, or ceases to exist. If you permanently move out of your service area of an Advantage plan, you have a guaranteed issue of a policy. And there are some trial rights. And this is around if you are age 65, newly eligible for Medicare, you take an Advantage plan right out of the box. Within the first 12 months of holding that Advantage plan, you are able to purchase a Medigap plan with no medical underwriting. That's one of the trial rights. So you're trying out your Advantage plan at age 65, first on Medicare. If you don't like it, you can buy a supplement plan with no looking at your medical conditions. So let's boil it down here. Something that's very important to many people is that with supplement plans, there are no networks. If a provider of a service accepts Medicare, they have to accept your supplement plan. So you're not looking at through books, you're not making phone calls, going on the internet to make sure that your provider is covered under the network. All you have to make sure is if they take Medicare, and almost all medical providers do. It covers all in some conditions and some plans, or most of your Part A and Part B costs. Remember, Medicare pays its share and the Medigap plan picks up the rest. You don't have to get permission slips. There are not denials as long as it's a Medicare covered service under Part A or B. And you can take this with you. Just because you move someplace, you don't necessarily need to change your supplement plan because remember, no networks anywhere in the country. Providers take Medicare, they're going to take that supplement plan. But it's important to remember that supplement plans or Medicaps don't include prescription drugs. So you would have to get a standalone prescription drug plan. It also doesn't cover things that original Medicare doesn't, like dental care, getting new glasses, or hearing aids. Original Medicare doesn't cover those three important things, and so your supplement plan won't either. The other thing to remember about supplement plans is this is insurance that you're buying, and guess what will likely occur with premiums? Well, probably they're going to increase every year, like almost all insurance does. And it's really important that you understand the guaranteed issue periods, because if you do not use your rights during your guaranteed issue period, the insurance companies can deny you a sale of a premium, or they can charge you more based on your medical condition. And then, of course, it's important to remember that these plans are all standardized. A Plan G is a Plan G is a Plan G, no matter from what insurance company you purchase. And I will caution you that if you're working with an agent, there's nothing wrong with that. Agents perform a needed, valuable service. But chances are they're only going to show you plans that they're licensed to sell. If you want to know all of your options, talk to a SHIP counselor or just visit our website, medicare.in.gov. You can click on the left-hand side, you can click on Medicare supplements, and then you click on compare Medicare supplements. You enter your age, your gender, your zip code, if you're a tobacco user, and which plan you'd like to compare. Hit the button, and then it will show up all of the supplement plans that you're looking at with all the companies who are approved to sell those policies in the state of Indiana. And they are ordered cheapest monthly premium to most expensive. But some people might not want a supplement plan for various reasons. So is there another choice? Well, there is. And they're called Advantage plans, also called Part C of Medicare. And how they work is that they are insurance Advantage plans. They're run by private companies, just like the supplement plans are. They're part of the Medicare program in that Medicare pays Advantage plans hundreds and hundreds and hundreds of dollars for them to provide all of your Medicare benefits. They're also allowed to include extra benefits like the dental, hearing aids, optometry. You hear a lot about going to the gym, that's covered. On the commercials, we hear a lot about all these other, I call them beeps and whistles, the over-the-counter things you can buy, the gift cards, meals delivered to your house, housekeeping. Advantage plans are now allowed to include all kinds of enhancements. It's just important to remember that the commercials you see or that maybe you read in the magazines and the paper, most of those times, those beeps and whistles are really specific to certain groups of people who have Advantage plans and only certain Advantage plans. So don't think that if you have an Advantage plan, the meal service is going to be coming to your house, delivering you hot and ready to eat meals. They may in certain circumstances, but they're very slim. Advantage plans are also called Part C of Medicare, Medicare health plans, Medicare replacement plans. But just remember, the structure of these Advantage plans is that they are managed care. The government gives the insurance company X amount of dollars to provide all of your care, and that's how that is managed. Now, that doesn't mean if you need more care that you're not going to get it. But that's just how managed care works. Here's your hunk of money, insurance company, take care of our person. Advantage plans are very regional and mostly they go by zip codes. So Advantage plans that my neighbors have access to may or may not be available to Megan's neighbors because we live 2.5 hours apart. So you have to look at Advantage plans by your zip code. It's important to remember that you are still in the Medicare program. You have all the rights and protections of any other Medicare beneficiary. But you almost always get more bang for your buck if you go to their in-network doctors, hospitals, and other medical providers. Some plans, HMOs, health maintenance organizations, have no out-of-network. So you've really got to pay attention to the details if you're an Advantage plan holder. You need to do your research. You need to make sure that you're going to in-network doctors and hospitals if you want to get the most bang for your buck and minimize your out-of-pocket expenses. Doctors, hospitals, other providers can leave these Advantage plan networks at their will. So if using a certain doctor is the most important thing to you, make sure they're in the network. Just understand that they may not be in the network throughout the year. Remember when we talked about Part B care is 80% on Medicare, 20% on you? Well, that doesn't have anything to do with Advantage plans. Advantage plans have their own charges, their own costs, and their own rules. So it's really important that if you're an Advantage plan holder, that you understand the structure of that plan and the plan's rules, because those are going to be different than Medicare, original Medicare. Now, there are certain times when you can change Advantage plans. And I think one of the best things about Advantage plans is that you can change an Advantage plan every year, no matter what, during the open enrollment period, which is October 15th through December 7th. If you find an Advantage plan that you like and it serves your area, they can't look at your medical condition. They have to sell you that plan. But there are also a couple of other times when you can change Advantage plans. If your plan decides to call it quits, then you can change your plan. If they move out of your area, you can change your plan. And of course, we know the annual election, the open enrollment period in the fall is the time. And then you get an extra 3 months. So if you go into the new year with an Advantage plan, you're still given the first 3 months of the year to make another change. You can only make one change, but you can make a change. So sometimes what we see is during open enrollment, someone chooses an Advantage plan and enrolls in it to beginning January 1 of the following year. So then after the following year starts, they're using their plan and it's just not the plan they thought it was. Their providers they like are not in the plan. And so they do have the first 3 months of the year to look for another plan and enroll in it for the rest of that current year. Now, a lot of people think, oh boy, I'm in an Advantage plan. It's going to cost me 0 premiums per month. Well, there are a lot of Advantage plans that have a 0 monthly premium. But remember, you're still in Medicare Parts A and B, and you're still paying that Part B premium. There are some programs that help people pay that Part B program called the Medicare Savings Program. They go by your income and asset. And that's something that SHIP counselors can help you look at also, just to see maybe if you'll qualify for that. Sometimes there is a monthly premium to the plan. There might be a prescription drug premium within that plan, or there just may be a premium. Sometimes there's deductibles for health services. Sometimes they're deductibles for your Part D coverage, because almost always your Part D, your prescription drug benefit, is embedded in your Advantage plan. But we see a lot of 0 per month premiums. That doesn't mean you're covered, your care is free, but your premium is 0. And as a reminder, the deductibles, the percentages that you pay, the fixed amounts, also called co-payments that you pay, they're completely different from Medicare, and they're different from plan to plan. And a lot of people say, well, I want those extra benefits, but I want the flexibility of going to whomever I want, not having to get pre-authorization for services. So I'm going to sign up for both a Medigap and an Advantage plan. That is not allowed. You have to choose one or the other. Let's talk about Advantage plan costs. We know the monthly premium varies from company to company. You still pay that Part B premium, remember? But we do see a lot of 0 monthly premium plans. And then you do have co-pays and co-insurance, which is a percentage for whenever you use medical care or purchase prescription drugs. Now, there are some Advantage plans that have a 0 copay to see your primary care physician, but most do charge for specialists and other kinds of medical care, largely under Part B. You'll also know your Part A costs should you, unfortunately, go to the hospital. It's all lined out on the Medicare.gov website. You'll know exactly how much things cost for your medicines and your medical care. Important things to remember. It's managed care, and inherent in managed care are networks of providers. We do hear from people that they were denied a service or had to get pre-authorizations for services. We don't hear about that with Medigap plans, but we do occasionally hear about that with Advantage plan holders. You just have to take care of the details with Advantage plans. And unless you have a wide coverage area for your Advantage plan, they're not going to pay for services generally out of your network. Now, there are some Advantage plans that do have some out-of-network coverage, but the deductible will be higher and the co-insurance and co-payments will be higher. And we've already talked about that providers of services can drop Advantage plans and be disenrolled from their networks. Now, another great thing about Advantage plans, they have a safety net, and that's what we call the maximum out-of-pocket costs. And you'll know that because it's all that information is right there on Medicare.gov. And it may be as low as a $4,600 annual maximum out of pocket, could be as high as $11,000. But at least you will know what that is if that's an important feature to a plan for you. Now, Megan, I don't know about you, but when I work with clients, a lot of them say, well, a few of them say, I want the plan that has the highest gift card or grocery card.
Yep.
But I'm here to tell you that is not the way you should pick out an Advantage plan. I mean, as shift
Never.
counselors, we really don't give advice, we give information. But when I have somebody that they're bound and determined that that's the only thing that's important to them, what I usually do is just say, well, let's look at all of the parts of this plan and make sure that 50 bucks extra a month on a better gift card does not outweighs paying more to go to the doctor, paying more for your drugs, paying more for this, that, and the other thing. So sometimes you got to take the big picture, and then what we all have to do is do the math to see if an Advantage plan would be advantageous, or maybe if we just paid more by the month, a supplement plan might work better for us. And I always say, if we had crystal balls and could determine in advance our health conditions and our consumption of medical services for the rest of our lives, we would not have the struggle that we have deciding whether to do a supplement plan or an advantage plan. But we don't know that. So you have to think about your tolerance for risk. Would you rather pay lower, knowing that you'll have to do a little extra homework, and then have more out of pocket when you use services? Or are you one of those people that says, I want to know exactly how much I'm going to pay every month. I don't want any surprises and I don't want to have to deal with the details. Then you may make a different decision. And that's not something a ship counselor can tell you. That's just something that you kind of have to figure out for yourself. But we do present some different scenarios that might help you kind of think about your approach to insurance and healthcare. So here it is in one slide, all of the most salient points so you can compare. Advantage plans usually have a lower or no monthly premium, but they have higher out-of-pockets generally. You have to stick to the provider networks to either get service at all or to get the most bang for your buck. They do add some fabulous benefits that are not covered under traditional Medicare. You can change your plan every year, which is, I love that about Advantage plans, and they can't look at your medical condition. And just remember that if you don't have a guaranteed issue period for a supplement plan, you probably wouldn't be able to go from an Advantage plan to a supplement plan if you have some significant and chronic health care. Because remember, supplement plans do have the right to deny you a sale of a plan based on your medical condition. Now, there's a trial right for Advantage plans, and we talked about this before, but just as a recap, if you join an Advantage plan when you're first eligible for Medicare at age 65, you have a 12-month trial right to try out that plan. And if you don't like it, then you can purchase a supplement or a Medigap plan with that guaranteed issue period. Now let's look at Medigap plans. Well, it's, likely your premiums are likely to increase each year. You perhaps cannot change plans each year, especially as you get old and sick. Now, you may be able to change plans, and many people shop themselves, even if they have certain conditions that aren't significant. We have a coworker who's, I think, changed her plan 4 times to get a lower monthly premium because she doesn't really have any significant medical conditions, and she was able to do that. But it's just not guaranteed. Now, Medigap plans are completely portable. You can go to any Medicare provider across the country. So you show them your red, white, and blue Medicare card, and you show them your Medicare Supplement Advantage, a supplement plan card, and you're good to go. But you need prescription drug coverage generally, and Medigap plans don't cover drugs, so you would have to enroll in a standalone prescription drug plan. Now, there is a trial right around Medigaps also. So say you buy a Medigap plan when you first get on Medicare and you have it for a few years and the prices are going up, and maybe you see your friends getting all these added benefits, the gift cards, going to the gym, all that kind of stuff. And you think, I want to try out one of those Advantage plans. You are allowed to do that once and put your Medigap plan on hold. Try an Advantage plan for up to 12 months. And then if you don't like it, you can go back to that Medigap plan. Now, it doesn't mean the price will be the same at that Medigap plan because maybe they've had an increase in premiums. Maybe you've turned a year older during that up to 1 year that you're trying out the Advantage plan. But you will be able to go right back to that same supplement Medigap plan. This does not mean that you have to fit in these scenarios, but Medigap folks, a lot of times if you have pre-existing conditions, high medical costs, you go to the doctor all the time, Medigap's cheaper in the long run. If you're one of those people that does not tolerate risk very well and you want to know what you're paying, then that's a Medigap person generally. If you travel all the time and you don't want to have to deal with networks, then Medigaps are often a good choice. And you have to understand that you might be paying, probably will be paying more per month, but as you receive services, you will likely have lower out-of-pocket expenses as you consume those medical services. Now, for Part C, your Advantage plan, folks. You're healthy as a horse. You only go to the doctor once a year for your annual wellness stuff. Many of those people like Advantage plans. And if you're convinced that you are going to be healthy as a horse for many, many years, then maybe an Advantage plan is for you. And then let's face it, there's a lot of us who cannot afford $100 or $150 a month just for the premium. And so a lot of times people who are more financially strapped look to Advantage plans for that lower premium. But it is important that if you are in that situation, yet you do get tons of medical care, you do have to look at what your costs are going to be when you get all your medical care that you know you're going to need. And sometimes you just got to do the math. So sometimes paying a little more a month makes it cheaper overall to have your health insurance cover your medical situation. And you got to be a person that likes to take care of the details. You know, there could be some additional steps to getting certain types of care. You have to make sure that your folks are in the network and, go by the rules. So that's what I have. And I hope that helps you understand the differences between Advantage plans and Medigap plans. And what I really want you to understand is that Indiana Ship Counselors are here to help you understand those one-on-one, either in person, over the phone, virtually. We want to help you understand your different options. We're not going to tell you what to do. We're not going to tell you what's good, better, or best, but we're going to make sure that you understand your options and very specific options. Like I said before, we can help you look at prices for supplement plans. We can help you look for Advantage plans, and we do that right over the computer. So we have all of the information at our fingertips, and you do too. But sometimes a lot of information is hard to digest unless you have someone that's knowledgeable helping you understand it. And that's what Indiana Ship Counselors do. It's a fabulous position, and it's a great service, and we get as much out of it as you do, I assure you. And also, I'll just put a plug in. You know, we're always looking for new ship counselors. We offer great training, great community of similarly minded volunteers, and we would love to have you join us. So you can find out more information about being a ship counselor on our website, medicare.in.gov. Megan, what else do you have for us?
Well, Susan, that was a wonderful presentation. I know I learned a lot. I don't see any questions in the chat box, which means you covered everything. Woo! Now, keep in mind, though, we usually give a little bit of a disclaimer that when we do these presentations, especially the Medicare 101s, the new to Medicare Advantage versus supplement, there's so much to cover, and everyone's situation is also different. So it's just a brief overview and to really dive into your specific situation. That's when you would want a SIP appointment so we can help tailor all the information to you. So, again, thank you, Susan, for the wonderful presentation. If you take down your slides, I can show the audience what we have coming up in September. So we have one more presentation in September, and that is going to be a fun one. So September the 22nd, we are going to talk about all that fun mail that you get in your mailbox every single day, but specifically around fall open enrollment. Whenever there's an enrollment season, your mailbox is going to get heavier and heavier. So we're going to break down what mail you need to open and keep and what mail you can just pitch. There are certain things that you can look for on the envelopes that will kind of tell you what it is. And we're going to walk you through that. We're going to let you know what you get from Medicare, what you get from your insurance company, things to watch for, and things just to ignore. So that is our one and only presentation left in September. And then we will be back in October with some fun ones as well for fall open enrollment. We just don't have those slides up yet. So without further ado, Susan, we will wave goodbye. See everyone in a couple weeks. Bye.